Good morning. My name is Andre Nunez. I'm a student physical therapist assistant, and I'll be working with you. Is that okay today?
Yes.
Okay. So for today, well, just so you know, in case things get a little dicey, I've identified your therapist of record, Amber Poitras, and we'll let her know if anything happens. Okay? Okay. So before we start, can I have your first name and last name and your date of birth, please?
Kayla Nunez, 11/20/97.
Okay. And Kayla, we're gonna be doing some muscle measuring. So I'm gonna be like applying pressure, telling you to kind of hold a position and applying pressure. Is that okay?
Yes.
We're also gonna be doing some range of motion measurement. So I'll be stretching you a little bit. Be stretching you and then taking some measurements. Is that okay?
Yes.
Before we start, do you have any underlying conditions like osteoporosis, osteoarthritis, any recent falls lately?
No.
Or more and so, any injuries in this area over here?
No.
Okay, thank you. For passive range of motion, patient is in a supine position. Patient is then taken into knee flexion. One hand is on the distal end of the tibia and the other is on the proximal tibia to stabilize. For active range of motion, patient is then asked to replicate the motion. For goniometry measurement of knee flexion, patient is in a supine position. My stationary arm is lateral midline of the femur. My fulcrum is the lateral epicondyle. My movable arm is lateral midline of the fibula. Normal range is 0 to 135. In this case, my patient had a total of 129 degrees of flexion. For general growth strength testing on knee flexion, patient is in a seated position and is then asked to perform knee flexion. After my patient performs slight knee flexion and holds a position, pressure is applied at the posterior distal tibia into knee extension, while the other hand stabilizes the anterior proximal tibia inferior from the patella. My patient was a 5. For manual muscle testing on the flexor hallucis longus, patient is in a seated position. Flexion is on the IP joint of the great toe is performed. Pressure is then applied on the plantar surface into extension. My patient was a 4+. For manual muscle testing of the medial hamstrings, patient is in a prone position. Knee is in flexion between 50 to 70 degrees. Hip is in slight internal rotation and pressure is applied at the distal lower leg into knee extension. My patient was rated a 4+. For my special test, I did the Thompson test for tendon rupture. The purpose is to assess a ruptured Achilles tendon. Patient is in prone with feet extended over the edge of the table. The therapist then squeezes the muscle belly of the gastrocnemius and soleus complex. A positive indication for this test is if there is any absence of plantar flexion while palpating the muscle bellies, and may indicate a ruptured Achilles tendon. My patient was a negative. For muscle length assessment of the soleus in standing, the tested limb is in slight extension, so there's also slight knee flexion, heel is flat on the floor, and the patient is asked to shift their weight forward until their heel almost comes off of the ground. You take measurement using the ankle dorsiflexion landmarks. My patient got 15 degrees.